So you guys know me, like I'm a media mogul now. This is my new thing. And so that means that I need to give the people what they want to hear. So I need to talk about what's hot. And so right now, Tiger King is hot, the 98 Bulls are hot, certain singers and dancers presumably are hot, and coronavirus is hot. And so I don't have much to say about the other topics, but I did just read this article in the New York Times from a couple weeks ago called "The U.S. Tried to Build a New Fleet of Ventilators. The Mission Failed," which I noticed wasn't discussed very much. And I also noticed had some larger, bigger picture threads related not just to our shortage of ventilators causing deaths throughout the country, but also our general shortage of healthcare supplies and lack of preparedness related to the market system and the perverse incentives therein. And so I'm going to read some excerpts from that article, and then maybe we could talk about some of the bigger picture trends related to it.
So 13 years ago, a group of U.S. public health officials came up with a plan to address what they regarded as one of the medical system's crucial vulnerabilities, a shortage of ventilators. The breathing assistance machines tend to be bulky, expensive, and limited in number, and so the plan was to build a large fleet of inexpensive portable devices to deploy in a flu pandemic or in another crisis. Money was budgeted, a federal contract was signed, and work got underway, and then things suddenly veered off course. A multi-billion-dollar maker of medical devices bought the small California company that had been hired to design the new machines, and the project ultimately produced zero ventilators. That failure delayed the development of an affordable ventilator by at least half a decade, depriving hospitals, states, and the federal government of the ability to stock up. The federal government started over with another company in 2014, whose ventilator was approved only last year and whose products have not yet been delivered. Today, with the coronavirus ravaging America's healthcare system, the nation's emergency response stockpile is still waiting on its first shipment. The scarcity of ventilators has become an emergency, forcing doctors to make life or death decisions about who gets to breathe and who does not. The stalled effort to create a new class of cheap, easy to use ventilators highlights the perils of outsourcing projects with critical public health implications to private companies. Their focus on maximizing profits is not always consistent with the government's goal of preparing for a future crisis, to say the least. Then it goes on to have more details about this specific contract and the companies involved. And so the project, which was codenamed Aurora, came in the wake of a parade of near-miss pandemics, including SARS, MERS, bird flu, and swine flu. Federal officials decided to reevaluate their strategy for the next public health emergency. They considered vaccines, antiviral drugs, protective gear, and ventilators, the last lines of defense for patients suffering respiratory failure. The ventilators were to cost less than $3,000 each. The lower the price, the more machines that the government would be able to buy. Ventilators at the time typically went for about $10,000 each, but getting the price down to $3,000 and getting it down to $3,000 would be tough. But Newport's executives bet that they would be able to make up for any losses by selling the ventilators around the world, Newport being the small company manufacturing them. The devices industry was undergoing rapid consolidation, with one company after another merging or acquiring other makers. Manufacturers wanted to pitch themselves as one-stop shops to hospitals, which were getting bigger, and that meant offering a broader suite of products. In May 2012, Covidien, a large medical device manufacturer, agreed to buy Newport for just over $100 million. Newport executives and government officials working on the ventilators contract said that they immediately noticed a change when Covidien took over. Developing inexpensive portable ventilators no longer seemed like a top priority. Government officials and executives at rival ventilator companies said that they suspected Covidien had acquired Newport to prevent it from building a cheaper product that would undermine Covidien's profits from its existing ventilator business. Some Newport executives who worked on the project were reassigned to other roles. Others decided to leave the company. In 2014, with no ventilators having been delivered to the government, Covidien executives told officials at the Biomedical Research Agency that they wanted to get out of the contract, according to three former federal officials. and the executives complained that it was not sufficiently profitable for the company, and so the government agreed to cancel the contract.
All right. So a few things stand out to me from that article, which are larger picture trends in the economic system as a whole. One is, it's easy to point at COVIDian and say that they're the bad guys for buying up the cheap company that was trying to make ventilators to help people. But in reality, they were doing exactly what their market incentives and their economic incentives say that they should do, which is maximize profits. You do that by decreasing costs. And so one way to do that is to gobble up your competition and reduce competition from cheaper alternatives, cornering the market in that way. And also another side benefit is that you want to consolidate the market. You want to not just reduce competition so that there's other cheaper ventilators, but if you own the market, then there's no competition in general, and you can charge what you will. And so that's a win-win. And if they didn't do it, then other large healthcare companies were doing it. Like I said in the article, there's a trend towards consolidation. And so as long as our government is run by a bunch of crooks and corporations and lobbyists, this is a type of dynamic that's going to continue to happen. And regulatory capture in terms of those companies having influence over whatever it is, the FEC or the SEC or any of the bodies that are supposed to stop antitrust, enforce antitrust laws and make sure that there aren't monopolies. It makes sense for the companies to try to influence those. And if people aren't getting involved through YouTube channels in the forest and talking to other people and paying attention to these things, this is just what's going to keep on happening. And so people are aware of the good things of our economic system in terms of, if you've ever taken an economics course or heard anything anywhere from anybody, it's probably likely to be all the great things about capitalism, insofar as that's something that is a consistent thing. And, the efficient market hypothesis and how competition breeds efficiency and everybody benefits and this and that. In reality, there are positive things about it in narrow circumstances with regulation enforcing those things. And then there are also times where it will never work. It will never work for the environment, where the tendency to commodify it will assign a near zero price to everything, and then will destroy it, and the cost will be distributed throughout society in terms of not having any animals, not having an environment to enjoy, future generations not being able to go anywhere. Our health will deteriorate as the oceans and the forests do. As well as a healthcare system. And so yo-yo might be like a yo-yo or a slinky or whatever trinket. You might, go to the one that's the cheapest, that's the best manufactured, and that way the competition wins out in terms of whichever company makes the best yo-yos is going to make the most money. But that's a good that you can decide to buy or not. If you get coronavirus, you have it, and you're kind of screwed with, whether you're rich or you're poor. And so the market system should not commodify healthcare or the environment or a number of other goods in that way. And so insofar as our economic system is kind of idealized and so some monolith that is coming down from the heavens and this is that, and there's no critical discussion of the negative aspects of it, this type of thing is going to keep on happening. And so I thought that was informative. Can you guys please subscribe to my YouTube channel? That's all that I'm asking you guys.